The medical information included in this podcast is provided as an educational resource only. Please consult your healthcare provider before making any healthcare decisions.
I want you to ask yourself this question. Am I living my best life? And if not, what do I need to do to enhance my life? Because that's part of the intention. And each of us has purpose, and we gain our purpose through hope, faith, and fulfillment. Let's be honest. None of us wanted to be plagued with Fabry's, and yet we are. And this leads me to the what is versus the what if. The what is we have this disease, or we're taking care of somebody who has this disease. The what if can send us into rabbit holes. What if this happens? What if that happens? And that leads to so many different fears. The what is allows us to stay in the present. Did you know that we have 86,400 seconds in the day? How are we living it?
Welcome back to the Fabry Cast, a space where we navigate life with Fabry disease, together through honest conversations, shared experiences, and knowledge from those who understand. Today, I'm honored to be joined by Linda Quaranta. Not only is Linda a licensed EMDR therapist with a passion for helping others heal from trauma, but she's also walking her own path as a Fabry patient. Her unique perspective bridges professional expertise with lived experience, a combination that bridges deep empathy and insight into her therapeutic approach. So in this episode, we dive into the power of EMDR. That stands for eye movement desensitization and reprocessing, and how it can support emotional well-being for those living with chronic illness. Linda shares how trauma and long-term illness often intersect, and how intentionally working with our emotional landscape can lead to greater resilience, balance, and healing. So hi, Linda, and welcome to the Fabry Cast.
Thank you so much for this opportunity to be able to share my experiences in dealing with Fabry's. I'm so blessed to provide key points of how I've been able to effectively work with people in exploring the mind, body, and spirit connection by addressing mental health wellness to assist in for my own and others' use.
Yeah, and I think we have a lot to talk about, you and me. So let's just start with getting to know you a little bit better. Can you tell us about your journey with Fabry?
Absolutely. So I was diagnosed with Fabry disease when I was 16 years old. And it was passed along to me by my father. And my father had been diagnosed when he was in his 20s. His mom was the one who passed it on. And so it's obviously a generational sheding. And with that, I have two younger siblings that do have Fabry's disease.
Okay.
Sister Carol is about 3 years younger, and Kristen is about 10 years younger. And the way that they went ahead and figured out that I had Fabry's was the swirling of the eyes. And a couple of things that were happening also before I was officially diagnosed was I had really bad heat and cold intolerance. And And my father ended up getting discharged from the Marines when he was about um, 20 years old. And it was a medical discharge because he was not able to continue in serving our country because of the medical condition. At that time, when I was 16 years old, I was told I was just a carrier. And so what
Right.
that meant was I could just pass it on and that I probably wouldn't have any symptoms, but the passing on would be a 50-50 chance to giving it to my offsprings. And I guess the hardest part for me is that watching my father in the situation of what he was going through leading up to his death really made me have to look at some of my own lifestyle choices. And because at that time, when I was diagnosed and well, he had the Fabry's, there were no treatments. And that was really sad because there was so much fear of the unknown of what was going to happen. And I made decisions on not having my own biological children, and I ended up adopting. And so it Fabry's has been there underneath, and it's made an impact. And I know we've talked a little bit, and you've had some situations with Fabry's, and I know you said that you have a, a, a child.
Yeah, I have two children. Yeah, and as I'm listening to you speak, I remember when we first spoke, we really touched on some of the things that we share in our paths, and probably a lot of people share. We're both females who live with Fabry. We were both diagnosed officially in the beginning as carriers, which we know today isn't. We're not carriers. We are Fabry females living with we have the disease. We both lost our dads, and I think that when you get to a point of your life when you're ready to have children, that's another place that Fabry really plays a big impact. When we do have two children, and a boy and a girl, and we haven't taken them to get diagnosed yet, or but it's all these things that play a role into our lives that shape who we are.
Yeah, yeah. And so fast forward, I didn't think much of Fabry's until when I turned the ripe age of 55. And I went on a hike one day,
Okay.
and it was pretty warm. And if my body overheats, then what happens is that I lose kind of bodily sensations. And in that height, I started having a racing heart. I started losing from the front end and the back end of my body. And it was really, really kind of distressing. And
Okay.
so I ended up going to the hospital. And I'll never forget that day because it was my birthday.
Oh no.
And where else can you go ahead and get 24-hour monitoring and care, a private room, and um, room service, and a bed that will lift your head up, and you get your own TV? Sounds
What a
like,
way. What
yeah,
a way to
yeah,
celebrate. Yep.
exactly. And so being in the hospital, um, and I had a birthday party scheduled for that night, and needless to say, no can do. So I spent the night at the hospital, and I always knew about Fabry. It just hadn't been at the forefront. And uh, one of the things that I think has really helped me in navigating Fabry is that I decided to go ahead and get my master's degree in psychology in 2004. And I really love working with people, and it's really a passion of mine. And the process of counseling, for those of you who have done it or haven't done it or considering to do it, is really a three-pronged process. First, we need to be able to reveal, we need to be able to talk about things that matter to us. Second, we have to go ahead and be able to deal. And that's looking at the coping situation of how do I better myself with this problem. And third, we have to be able to heal. And healing is such a process. And I know that for Fabry's patients, it can be very complicated and frustrating because sometimes we just don't know where we're going with this. We've seen other relatives and people suffering with this disease, and we're even suffering. And so, another quote that really speaks to me is, "What I resist will persist. If I don't deal with the stuff, it's going to continue to happen." And I love the one time I asked one of my clients, "What's the reason you're here?" And she said, "I'm so tired of my shit show." At that moment, I could relate because all of us understand poop, shit, and crap. And that, in essence, we have to learn how to clean that up. And so part of my work is being able to help people flush their toilets.
Well said. And I think that that is easy for, you're right, for people to really understand what it is that we're trying to accomplish. And even in this podcast, for them to take that to learn, what can I flush down today? And how do we do that? And, I remember when we first spoke, I wrote down something. I had my piece of paper and pen, and I wrote it down because I loved when you said it. And it was, when we pay attention to what's going on in our body, the body feels understood. Can you talk about how this relates specifically to Fabry patients and living with the disease?
Absolutely. So most of you who are listening to this podcast already know that either you or somebody else has Fabry disease. And it's just important to be able to share our journey, because when we feel understood, our bodies don't have to scream out, "Hello, are you paying attention?" Because as we are navigating, I think one of the things that we have to also look at is the process of change. Change happens, number one, when we have awareness. What's the intention, and how am I going to practice it? And it's sometimes very difficult in the practicing. So, Julia, then I don't know how close you are to the beach. I'm just a stone's throw away from the beach, about probably a half hour. But next time you're at the beach, I want you to imagine being able to stop the waves.
Okay.
Can do? Can't do?
No, can't do.
Okay. And so I like to use the wave metaphor because as you are navigating your waves, you're going to have to be able to style flex, in the sense that you're wanting to go ahead, and a tsunami wave is going to be needed, will have to be ridden in a very different way than these gentle waves. So we have to go ahead and embrace change. And change is not easy for most people. And yet it can be really, really necessary. I want to ask. Go ahead.
Well, when you said change happens when we have awareness, I was thinking, how do how does someone get awareness in the first place? How do we know? And, when do you have that light bulb moment, or how do we help people get to that place where they recognize?
Well, we gain awareness because we're out of what I call denial. Denial is don't even notice I'm lying. And when we're lying to ourselves. And
Right.
so being able to be aware, most of us know that we have a progressive disease and that if we don't take care of it, it's going to take care of us in an adverse way.
Well said.
So I want to have you ask yourself this question. Am I living my best life? And if not, what do I need to do to enhance my life? This leads to our intention. We all have purpose, and through purpose, we gain hope, faith, and fulfillment. None of us asked to have Fabry, and yet this is a reality. This is the what is versus the what if. The what is allows us to stay in the here and now. Today is your present. You have 86,400 seconds in a day. How you live in that? And living in the past or getting ahead of ourselves with the future doesn't serve us well. I often ask myself, does my past own me or do I own my past? When my past owns me, same words. Where am I living? In the past. And if I own my past, I can go ahead and live in the present. And as I say, today is the gift. You're never going to get these 86,400 seconds back. Because after today, it's now in the past.
Mm-hmm.
And so paying attention to where we are in our journey makes a huge difference. When I live too much in the future, I miss the gift of today. I'll get to the tomorrows when I get to them, and they will become my present and gift. So I find that living in the here and now really makes a difference. And paying attention to our bodily sensations can lead to a feeling of being understood.
Right.
When we think about Fabry and we think about some of the big things that we go through, there's a lot of fear that takes place in what could come. How do you bring yourself back to the now when you find yourself being caught up in those thoughts?
Yeah, absolutely. And our bodies and brains can go ahead and remember everything.
Mm-hmm.
Some of the things that we experience, especially the common fears, I think that most people can relate to, are abandonment, rejection, judgment, stigmatization, and the fear of the unknown, the fear of failure, fear of death, pain and suffering, disability, social isolation, financial strain, and losing control can really feel overwhelming.
And how do you go from those scary thoughts? For example, we both lost our dads, and we have the disease that our fathers had. I think that always plays a little bit in the background. At least it does for me. And we know that the outcome of today is going to be very different than what they had. And plus, we are females who don't, who generally are on the less severe side of Fabry disease, generally. So even with that, and even knowing that, there's still this feeling that we have the disease that our dads had. When that plays in the background and of your life, how do you just kind of bring that back in and say, okay, it's okay, because we're living in the now. Do you give that a certain amount of attention, and then you keep focusing on the day that you have in front of you? How do you what would you say to your
Well,
your
what
clients?
what hap- what is a really good metaphor for me is that emotions and feelings,
Hmm.
thoughts, they come and they go. They're like visitors. We can all relate. There are some visitors that are very, very welcomed, and others who are not so welcome.
Right.
And by going ahead and identifying, hey, fear is coming into play right now. How long do I want to entertain that visitor? For me, I want to bring the awareness,
Right.
and the intention of, well, wait a minute, do I want this visitor to stay that long? And then I practice going ahead and getting that visitor out.
Hmm.
Remember COVID? Huh, who can't who can't forget COVID, right? So,
Right.
there were certain things that changed our lives in that, and that was that we ended up having to shut restaurants down. And I remember where I was living, the only time that you could go ahead and dine is if you did takeout. And of course, you better be masked up to go ahead and do any takeout, right? And um, so what would you feed um, welcomed visitors in your house?
Um,
What are some foods that you like, Julia, that you enjoy eating?
yeah. I like salmon and vegetables. Probably would be my go-to.
Okay. And
Okay.
is there a specific drink that you like to drink?
Um, well, mostly water, and then if I'm have it's a later in the evening kind of thing, maybe a glass of wine,
Okay.
margarita.
All right. Absolutely. So right now, joy and happiness are at your door. They're knocking.
Right.
Do you let them in?
Yes.
Oh, of course. And what are you going to feed them?
Margaritas.
We're having a party. So now anger just came and showed up at the door. And anger is really upset because you invited joy and happiness to enjoy margaritas. Do you want to let anger in?
No.
Absolutely not. So, what are we going to feed anger? Are we going to feed anger the salmon and the vegetables and a margarita and maybe a glass of wine? No. So, what are the foods that you don't like eating?
Um, Geez, what are the foods I don't like eating?
Well, let me share with you what I don't like eating: liver and onions.
Good one. Okay. Yeah,
Okay.
liver.
Because I don't know how you can cook that and enjoy it. Okay. So, some of the things that I would not eat is liver and onions. Does that help you with what you don't want to eat?
Yeah. I don't like certain vegetables like some like radish. Can't do a radish. Um, don't like fiddleheads. If you know what fiddleheads are, I don't like them.
Okay.
Yep.
Look, what do you want to pack anger?
Some fiddleheads.
Yeah. So he's got it in his little bag and he goes off and he looks in there and there's fiddleheads. And I have no idea what a fiddlehead, but I take it as bad as liver and onions. Okay. And so now happiness and joy, they're going to go to the happiest place on earth, Disneyland. So you're going to pack them all the things that you like. You're
Hmm.
going to sneak in a couple of margaritas. And now anger comes back, but he's brought a friend anxiety.
Mm-hmm.
What are we going to go ahead and pack?
Radishes.
Yeah, radishes. And they're like, really? Seriously? And it's kind of getting later in the day and that they want to go ahead and spend the night. I don't know about you. I'm not offering my comfy bed and
Nope.
with a nice down comforter. I have garbage cans outside, so I put them there. And then they come back and say, hey, can I have bedding? And I'm like, oh, sorry. It's all getting washed right now for joy and happiness. They're going to be back at any moment. So this is the metaphor of being able to, what do I need to pay attention to?
And how do you throw it in the trash? Yeah.
Yeah.
Yeah, I like it.
Flush it
Yeah,
down the toilet.
how do I flush it down the toilet? That's right.
Yeah.
So for EMDR, I'm thinking for people listening, they may not all know what that means. And would you be able to explain to someone who isn't familiar with this modality what it is?
Yeah. EMDR is eye movement desensitization and reprocessing. And it's proven to help reduce symptoms up for depression, trauma, PTSD, anxiety, medical conditions, pain, emotional issues. Like it's for me the gold standard of treatment. And it's my go-to. Probably 90% of people that come to me want EMDR. So you're probably asking yourself, okay, about this gold standard, how does it work? So EMDR has a direct effect on the brain processing information. So releasing these emotional experiences that are trapped in our nervous system. And one of the key components of EMDR is the bilateral stimulation.
Okay.
And you have to go ahead and work with somebody who's trained to assist you in accessing those disturbing memories, images, events, and consequences. So, this trained therapist is going to help you recall a disturbing event, feeling, memory, or bodily sensation. The beauty of EMDR is you don't have to talk about all the shit poop. Because each time you talk about it, you're re-traumatizing yourself. Because that narrative is channel one, channel one, channel one. And we want to be able to help the person go and discover 2, 3, 4, 8, 6.
Right.
Those are all different options, but I don't have to keep going back to channel one. By using that bilateral stimulation, using visual or audio or tapping. And these memories are reprocessed by the brain, resulting in painful feelings being exchanged for resolved, peaceful feelings, which is what I call the AIP model, adaptive information processing. It's through the bilateral that the left and the right brain start to connect. And people report making more progress in much less time with EMDR therapy rather than talk therapy.
Wow. Okay, I have a couple questions.
Yeah.
Bilateral stimulation. So that means right to left.
Yes, or left to right.
Or left to right. Okay.
Yeah.
And that can be in many different ways. So hearing. So for example, the binaural beats, which I think we're going to touch on, but that's what that could mean. Okay. Mm-hmm. Looking at a screen, or does it count if you're walking outside and you're looking right to left to right?
Oh my goodness. You've touched upon one of my favorite things. I get up, suit up at 5 a.m. and I walk for about an hour.
Okay.
Right, left, right. I much rather prefer to go ahead and walk outdoors unfortunately, we have coyotes around us, and I don't want to become coyote bait. So I'm on a treadmill, and
Okay.
it's wonderful because for me, it allows me to reprocess things through that and ever think about things that maybe you weren't thinking about. The unconscious starts to become conscious. And that's the
Amazing.
premise of EMDR. It
Amazing. Go ahead.
You had some other questions?
I do. So I'm trying to think of if this is something new, a new concept to me. I'm thinking just by doing this movement, so whether that means hearing or looking, like visual, that alone, or your body walking, right? So movement through walking as well, or movement. So that alone can help our brains. Then does it bring us into a calmer state? Or does
Well,
it also help us move through the hard things that we're having to go through in life?
both.
Great. Okay.
So when I am installing a meditation with Calm Place or something like that, we would do very slow butterfly hugs. And butterfly hugs involve a 1, 2, 1, 2, very slow. And it's bilateral 1, 2, 1, 2. If we're trying to get through the yuck yuck, then we are going to speed up the process to get you to the other side.
Yeah. Okay. Now, what if you're going through a moment of pure joy? Is this something that you would use a butterfly hug to kind of lock in our brains as well?
Absolutely. Absolutely. So sometimes when I'm watching a movie and I'm just enjoying on my lap, I would just 1, 2, 1, 2, because I'm installing that. I'm getting it into my system. And in doing that slow tapping, I'm able to calm my body, my nervous system down. So
How often do you usually do that for? Is it about 30 seconds or can it be 10
it
minutes?
can vary. It's
Okay.
whatever you need at the time. So
Okay.
one of the things that is a symptom for me that is problematic is I get very, very overwhelmed when there's a lot of stimulation audio. And so if I'm at a restaurant, I have to wear earplugs just to quiet the sound. But underneath the table, you can catch me doing very slow taps on my lap. And right now I'm tapping. And I don't know if you can tell, but I'm tapping.
I can't tell.
Yes, nor can anybody else. So that can help you to regulate things for yourself.
Amazing. Well, this is something we can all try, whether we're listening right now. As long as you're not driving, I suppose you might not want to take your hands too far off the wheel, but something that we can try. And so, if you're not watching Linda and myself right now, you can try it. You can put your hands on your shoulders and then you go back and forth really slowly. So, you can try that. And I think it's just all about, just trying new things and seeing how this works for you and your body. Very, very, very cool because I like things that we can easily do and incorporate into our lives.
Yeah.
And a good takeaway.
Yeah.
Yeah. How does EMDR differ from, how is EMDR different from other counseling modalities?
So before I learned how to be a certified EMDR therapist, I was using cognitive behavioral therapy. Cognitive behavioral therapy deals with our thoughts, which are cognition, feelings and emotions, behaviors and actions.
Okay.
EMDR really hones into all three of those components, but the added benefit is the bodily sensations. And our bodies remember everything. They store everything. And yet, so much of the information that we're getting each and every day, we're not even aware, but it's stored in a way that can also be that can be adverse.
Mm-hmm.
We don't even know that. So one of the other key components is that EMDR also has 8 stages. And I like that because it kind of we're able to anchor what we're doing.
And as I'm listening, I'm thinking about a lot of people who have Fabry who also have lost their parents and maybe have had similar situations. And I think it's normal as humans to sometimes we take these hard things that we've experienced in our lives and we sort of tuck them somewhere in our brain as a way to protect us. And it sounds to me like EMDR can help us process these hard things tucked inside.
Yeah. And EMDR is just amazing because you don't have to talk about it.
Mm-hmm.
You get to go ahead and help your brain go into an adaptive information processing, seeing something very different. It's still there.
And
It's still
yeah,
there. You can't erase that. But the way that you look at it and the perspective that you have has become less emotionally reactive.
do you think that with your expertise in EMDR and then your own personal life, do you think that you view Fabry different than even you did when maybe you weren't at the point of wanting to be so aware of it?
Yeah, I do. I mean, and I think that has really helped me navigate how I do my life.
Mm-hmm.
And, you know, one of the things that is really crucial is being able to help yourself with stress. Stress is a killer. And when I'm working with people and even myself, you know, I'm not thrilled to be getting up at 5 a.m. to face the gym.
Right.
And yet, exercise and meditation can very much help regulate ourselves. So if you're not doing that, and I know many of people who have Fabry's, they have limited mobility, and yet there's chair yoga, there's, you know, things that you can do, and if you don't if you don't use it, you lose it. Yeah.
Yeah. Yeah. And what advice would you tell someone who wants to do EMDR as a treatment modality?
All right. So you know, with anything, you have to go ahead and find a therapist that is qualified.
Okay.
You don't want to go ahead and have somebody who doesn't know what they're doing because that would be adverse.
Yeah.
And then the second thing is choose a therapist that you like and trust. I tell my clients, I don't care if you like me. It's nice, but we have to be able to trust the process.
Agreed.
You have to feel like you're valued, you're respected, and that I'm going to be on this journey. I liken myself as a Sherpa. I know nothing about mountain climbing, but what I do is I take my clients from one base camp to the next base camp to the next base camp. And pretty soon we're going up the mountain together. This isn't a journey that any Fabry patient has to do alone. There are people who will go ahead and support you. And if the ones that are with you aren't, go find some other. Go find your tribe. Third is never feel pressured. Only you decide when you're ready. Well, if you're working with a therapist and you trust them at some point, we got to go ahead and jump into something different. And then fourth, understand how EMDR works in the brain. And I do a lot of psychoeducation because knowledge is power. And when you have the knowledge, you have the power to make different choices. And then next, which is really cool, is to expect beneficial results to continue. So at that time, maybe we didn't go ahead, and I have a chart, maybe we didn't get the subject unit of distress down to 0.
Right.
We were able to take it from 10 down to maybe a 2 or 3. And as we continue to work through these things, we get down to a 0. And the last thing, the sixth thing, is it's important when you're doing EMDR to look at yourself as observing. Be an observer.
Okay.
Because basically, got to introduce my friends here. Here we are. And this is you at this time. At another time, you were at this age. And at another time, you were possibly at this age. And this is the inner child healing work that needs to be done through the EMDR. So as an example, you probably have spilled some milk in the past, right?
Mm-hmm.
And depending on what age you remember spilling the milk, which might be this, there was, oh my gosh, a reaction from a caregiver. Most people don't know what they know until they've kind of looked at what they need to know. And so if the reaction from your caregiver was, I can't believe you spilled the milk and da-da-da, and be some yelling and now clean it up. And, this is what's stored here. As an adult, we have to reparent that child. Normalize it. Hey, everybody spills the milk. It's not a big deal. I think I had probably some sort of trauma because when I drink, I have it contained.
Yeah.
So this works for me.
Right.
So that being the case, now, I have an adaptive way of coping with spilled drinks. That's what happens. But unconsciously, we bring these things up to the surface and we deal with them. And so as we observe what's happened, we understand we're in a different place and we can become we are the adult.
Yeah.
And we can help our little ones heal.
I love that.
Yeah. So
yeah, I love that.
Play when I'm doing therapy too. That's what I'm doing what I do. Yeah.
I love that example. For people that are listening who do want to find an EMDR therapist in their local area, you shared a link with us. So it's www.emdria.org.
Yes.
So go ahead and you can check out that link and it will bring you to someone. Linda, you brought us so much today. Do you have any final messages or any final words you want to share with us?
Yeah, absolutely. We each are the creator of our lives. Your journey matters. Your experiences, your insights can inspire others and contribute to the overall awareness of Fabry disease. While there's challenges, finding a positive aspect of your day really helps to ground us in the here and now. Be intentional about the things that you can do to improve the quality of your life. Finding that joy, pursuing things that you love and are so important. Surround yourself with people who are going to support you and that you can support them. Making the changes that will guide you to living your best life is key. Live in the present. Don't live in the what ifs. Allow your past to be the past and give today, the present, a gift to yourself. Remember, each of us have a unique journey, and finding what brings us hope, peace, and comfort and happiness can be so enriching. We are so much more than Fabry's disease. It doesn't have to define us. Rather, we have the ability to find purpose and meaning in our best life. Be vulnerable of allowing people to help you. You don't have to suffer alone. May you be blessed and be a blessing. And I love the opportunity to share in the journey of Be Rare, Be You movement.
Thank you, Linda. Whoa, those are some strong words, and I love every one of them. You've given us a lot to reflect on, and the way that you approach healing leaves such an impact. For those of us living with Fabry, your insights into EMDR and intentional living are more than tools. It's a reminder that we have power in how we walk through life with Fabry. So, like Linda said, you have 86,400 seconds. How are you going to live them? Thanks for being here, Linda.